Nursing care plan for fever. Nursing assessment. 1. Vital signs. Monitor and document the patient's temperature regularly. Assess heart rate, respiratory rate, and blood pressure. 2. General appearance. Observe the patient's overall appearance and behavior. Note any signs of distress, restlessness, or lethargy. 3. History and symptoms. Assess medical history, chronic illnesses, recent infections, or exposure to contagious diseases. Assess the presence of associated symptoms: chills, headache, body aches, cough, sore throat, or rash. 4. Physical examination. Assess the patient's skin for color, moisture, and any rashes. Examine the respiratory system for signs of congestion or abnormal breath sounds. Check the cardiovascular system for signs of increased heart rate or low blood pressure. Evaluate the neurological system for altered level of consciousness or confusion. Assess other body systems based on the patient's symptoms, VVIV, and history. 5. Infection control. Determine the potential source of infection and assess for any signs of local infection, redness, swelling, or drainage. Implement appropriate infection control measures, hand hygiene and isolation precautions if necessary. 6. Fluid balance. Evaluate the patient's hydration status, assessing skin turgor, mucous membranes, and urine output. Monitor fluid intake and output to ensure adequate hydration. 7. Monitor for complications. Watch for signs of complications associated with fever, such as seizures, dehydration, or altered mental status. Assess for any signs of sepsis or systemic infection, including increased heart rate, decreased blood pressure, and altered level of consciousness. Nursing diagnosis. 1. Hyperthermia related to increased metabolic rate dehydration. 2. Imbalanced nutrition less than body requirement related to loss of appetite. 3. Risk for infection related to presence of fever, weakened immunity response. 4. Risk for deficit fluid volume related to elevated temperature, inadequate fluid volume, fluid loss of through sweating. Nursing diagnosis. 1. Hyperthermia related to increased metabolic rate, dehydration. Goals: to maintain normal body temperature. Planning: remove excess clothes. Monitor vital signs. Give tepid sponge bath. Administer antipyretic as prescribed. Maintain QHT chart. Control environmental temperature. Implementation: removed excess clothes. Monitor vital signs. Gave tepid sponge bath. Administered antipyretic as prescribed. Maintained QHT chart. Controlled environmental temperature. Evaluation: blood pressure, pulse rate, respiratory rate temperature. Fever is reduced by 2 Fahrenheit. Evaluation: blood pressure, pulse rate, respiratory rate temperature. Fever is reduced by 2 Fahrenheit. Nursing diagnosis. 2. Imbalanced nutrition less than body requirement related to loss of appetite. Goals: to maintain normal nutritional status. Planning: give oral care before eating. Administer antiemetic as prescribed. Administer IV fluid as prescribed. Give warm meals. Explain to the patient on importance of adequate intake for recover. Implementation: gave oral care before eating. Administered antiemetic as prescribed. Administered IV fluid as prescribed. Gave warm meals. Explain to the patient on importance of adequate intake for recover. Evaluation: to be evaluated later. Blood pressure, pulse rate, respiratory rate, body temperature. Nursing diagnosis. 3. Risk for infection related to presence of fever, weakened immunity response. Goals: to prevent infection. Planning: maintain aseptic technique. Assess inflammatory signs. Monitor vital signs. Administer antibiotic as prescribed. Monitor WBC level. Implementation: maintained aseptic technique. Assessed inflammatory signs. Monitored vital signs. Administered antibiotic as prescribed. Monitored WBC level. Evaluation: WBC level. Blood pressure, pulse rate, respiratory rate, body temperature. Nursing diagnosis. 4. Risk for deficit fluid volume related to elevated temperature, inadequate fluid volume, or fluid loss of through sweating. Goals: to maintain normal fluid volume status. Planning: monitor dehydration signs. Administer IV fluid as prescribed. Monitor input-output chart. Monitor vital signs. Implementation. Monitored dehydration signs. Administered IV fluid as prescribed. Monitored input-output chart. Monitored vital signs evaluation. Know any signs of dehydration. Skin color.